try and help Catherine get in as a panelist, that'd be great. So let's start, and hopefully a few others will join us soon. So welcome everyone, and thank you for joining. I know in the middle of a working day, and so maybe not the most convenient time for everyone. So we really do appreciate you taking the time to join us to talk about winter illnesses in children and young people. So if you want to just go to the next slide, Ema. And I think that should be a bit of an agenda. Oh, so this is an introduction to panel members. So I'll introduce myself, obviously. So I'm Carolyn Sharp. I'm a consultant in public health for the City and Hackney Public Health Team, and I lead on children, young people and health protection. So we do have one of our panel members here at the moment, which is Dr. Khan. So I'll let him introduce himself briefly.
Thanks, Carolyn. Hi, everyone. My name's Tasim Khan. I'm a GP at Spring Hill Practice in the north of the borough. And I've been working on the COVID and flu vaccination programme, and more recently, the polio response across City and Hackney and also across London. So great to be here.
Brilliant, thank you. We also have Catherine Sequoia, who I think many of you have met before. She's an immunisations and infection prevention and control nurse who's worked in City and Hackney for quite a long time. She's joining us at the moment. She's just struggling with a few technical issues. And we were hoping Dr. Dallas would be able to join us as well, but he may have got caught up with other things. But so it will be Dr. Khan, myself and Catherine by the looks of things, unless Dr. Dallas can join us last minute. If you want to just go to the next slide, Ema, well, this is just what we're planning to cover. So we were going to go over the Group A Strep situation and then talk about polio quite briefly, and Dr. Khan will cover that if Dr. Dallas isn't available. Then we'll give a bit of a presentation on vaccines as well, hopefully covering all of that in the first 30 minutes or less to give a good amount of time for questions from attendees. So if you do have questions, please, as we're talking, put them into the chat function. I'll monitor them, and then I can put the questions to the panel at the end. So yeah, please think of questions and add them into the chat at any point. Okay, so if you want to go to the next slide, we'll kick off with Group A Strep. So I'm going to cover this section. So this first slide really is just to show that Group A Strep infections do peak sort of in the springtime on an annual basis. So you can see the highest peak there in the kind of sort of light dark, in sort of the medium shade blue, was in 2017-18, which was the most recent highest peak. So on an annual basis, we do see increases. From year to year, those increases do differ. But what's sort of interesting about this year is that if you see that sort of light blue line right at the start, it shows the number of Group A Strep infections increasing quite steeply and earlier on in the year than what we tend to see. So typically the infections peak in spring. What we have seen this year is infections peak much earlier, so sort of over December, just before and over the Christmas period, which is a little bit abnormal. And then if we move to the next slide, you can see there these on the x-axis, that's the months of the year. So over November, December and January, there was a huge peak in scarlet fever consultations in GP practices. So lots and lots of Group A Strep bacteria circulating in the community. There was lots of coverage about this in the media, and so lots of people came forward to seek support from a GP. But what you can see quite encouragingly is that peak has dropped off very sharply in January. So that those numbers have gone down again, which is obviously really good news. But what I suppose we'll have to do is watch and wait to see whether the numbers go back up again over spring. Like I say, typically Group A Strep infections peak in the springtime. And so we don't know whether the numbers will go back up again, or hopefully they'll stay low. But that's sort of a bit of an overview of what's happened this year and why it's a little bit different to what typically happens on an annual basis. So if we go to the next slide, please. This slide is just, so what is Group A Strep essentially? So Group A Streptococcus, or also sometimes referred to as Strep A, is bacteria, and it's quite a common bacteria found on the skin or in the throat. And sometimes that can lead to infections. So one of the infections that you typically get from Group A strep is scarlet fever, but there are others such as cellulitis and impetigo. So thinking about scarlet fever, particularly because that is a very common presentation for Group A strep, it's usually a mild illness, but it is highly infectious, so it can be spread very, very easily from person to person. And so scarlet fever is something that we do recommend is treated with antibiotics, and that's just to prevent the risk of spreading to other people. Like I say, it's very highly infectious, but also to reduce any risk of complications as well. And so if you think about what those complications might look like, so in very, very rare occasions, the bacteria can get into what we call a sterile site, so somewhere like the bloodstream, where a more invasive and serious illness can happen. So that is really uncommon, but there has been an increase in those cases, particularly among children this year. And as you may have seen in the media coverage, there were a small number of deaths among children as well. But we do want to reiterate, I put it at the bottom in sort of bold and blue, that it is really rare for children who have got scarlet fever to develop an invasive infection. So if we move to the next slide, please. So this is just a bit of an overview of when to seek help and how to seek help. So most causes of sore throats and high fever in children are just from viruses such as cold, flu and COVID. And so the symptoms of scarlet fever that we want people to look out for are a high fever with a sore throat, with swollen tonsils, and a really characteristic red or pinkish rash that feels like sandpaper to touch. So if a child has those symptoms, that's when you should seek help from a health professional. So speak to a pharmacist or a GP, because like I said before, scarlet fever should be treated with the antibiotics. And any child that has got scarlet fever really should stay away from school or nursery for at least 24 hours after starting their antibiotics, because like I said, it's very, very easily spread. And so we don't want any children going to school ill and risking the spread to others. So if we go to the next slide, this one is just how to prevent the Group A strep infection. So the way it's spread is by close contact with somebody who is unwell. So through coughs and sneezes, or if they've got an open wound, it can be spread that way as well. So crucially, there's no vaccine against Group A strep itself, and the main preventative measures are really good hand and respiratory hygiene. So all of the things we were doing over COVID are still really important. So like I've said about keeping away from others if you're unwell, but also teaching children how to wash their hands with hot water and soap, and covering your mouth and nose with tissues and binning used tissues as quickly as possible. All of those really simple things make a huge difference when it comes to reducing the risk of spread of infections like Group A strep and others as well, like flu and COVID. And then I've put at the bottom that a recent study has actually found that the flu nasal spray vaccine may also be protective for children against Group A strep infection. So that is one way to protect against both Group A strep and also flu, which are circulating this winter as well. Next slide, please. Right, so I'm going to stop there, and I can see that we do have Dr. Dallas on the call. Welcome. Do you want to, are you okay to come off mute and introduce yourself and cover polio? Is that all right?
I'm sorry, I had a bit of technical difficulty, and that's why my camera's not working. My name's Dr. Edward Dallas. I'm a paediatric consultant who works at the Homerton Hospital and has sort of good relationships with the community in Hatzola and A&E. And today I'll be talking to you about polio. So the reason why we are asking people to get a polio vaccine is because there's been a vaccine-derived polio virus, and what that means is a slight change in a sort of mutated, excreted version, which has been from a patient given an oral dose of the vaccine. And so there's a theoretical risk that people might contract polio from sort of sewage contamination. So this is a very low risk, and the vaccine-derived polio virus, which they found, isn't related to the actual vaccine booster. So the vaccine booster is an inactive polio vaccine, so there's no chance of you actually getting polio from the vaccine. And that's why we're offering it to all children to try and protect against this potential risk. And the reason we want to is polio is an awful disease that causes paralysis and disability, and there's no cure for it. And so the only way we can kind of protect it against it is to give a proper vaccine schedule. Could I have the next dose? The next slide, please. Thanks. So thankfully, it's extremely rare in the UK because of the vaccination programme. The vaccination programme is actually on the right there, and we would give it normally at 8, 12 and 16 weeks. And so there's quite a lot of people who might be at some point or along that schedule, or might have missed a schedule, or perhaps they were unwell. So we would ask them to get a catch-up dose. And so if you'd like to check with your GP, we can kind of go through where you are along the vaccination schedule, which vaccinations you've had, and which vaccine is the most appropriate for you. But we'd like to remind you that we do need sort of 5 vaccinations to be vaccinated against polio fully. Next slide, please. So the reason, one of the reasons we're doing this talk is to basically show that our area is slightly lower on uptake of vaccines in general. So it's quite a complicated slide with lots of colours and lots of data points, but essentially City and Hackney, which is the blue line on the bottom, equates to around sort of 30% of vaccine uptake. So, and Waltham Forest has 50%. So we're quite a lot lower than other parts of London, which puts all the children basically at more risk, because you would get less herd immunity, as well as just not being vaccinated yourself. Next slide, please. And then I'll hand over for the next section.
Thanks, Dr. Dallas. So my name's Dr. Khan, as I mentioned at the start, and I'm going to be mainly talking about vaccinations and the importance of vaccinations throughout the life course, starting really in early sort of childhood, so when you're a baby, but actually even before that, in pregnancy, when women are pregnant, the importance of getting vaccinated to help protect their baby. So just some key headlines to start off with. So we know vaccinations protect us from serious diseases and help save lives. So after clean water and sanitation, vaccinations have been the single most effective public health intervention to help protect us from disease and ill health throughout the last 100+ years. And they have been rigorously tested and are safe and effective. So we've been using vaccinations for over 100 years. And many of the vaccinations that we use now, in fact, all of the vaccinations, that we use now have gone through rigorous testing in mass studies. So, for example, I was a participant in the early COVID vaccination trials, and alongside tens of thousands of other people. And at every stage, all the vaccinations are monitored, and only when they have reached a safe level of being able to be used in the public are they actually released, and then they're tested and monitored throughout the implementation in the general public. And actually we've got a lot of evidence for all the childhood vaccinations and the flu vaccinations that we use, that they are timed at the right time in your life, so starting at 8 weeks of age, so that it protects you and your child against some of these vaccine preventable diseases. And that just like other medications, vaccinations are no different, and they do create side effects, but most of these side effects are mild and can be treated. And it's really important to remember that, because I know that it's obviously a stressful thing for your child, your young baby, to have vaccinations, but these are normal feelings that we feel as parents, and you can help some of these side effects by giving things like paracetamol to help fevers, etc. But I'll talk a bit more about some of the side effects later on. Next slide, please. So this again relates to what Dr. Dallas was saying earlier. So why are we talking about vaccinations today on a Thursday afternoon with you all? And it's because really, if you look at these three graphs of coverage of vaccination across City and Hackney, compared to London in the middle and then England on the right-hand side. So these are childhood vaccination. So the yellow is the tetanus vaccination, the polio vaccination, and the red one is at different is at 1 year of age. So it's at different ages of childhood and different types of vaccines. But as you can see, consistently throughout the different vaccines and different ages, in City and Hackney, we are considerably lower in our vaccination uptake. And if I was to do a graph, a fourth graph of North Hackney, we would be even further down compared to Hackney and City. So actually some of these low figures in City and Hackney is because of North Hackney. Really, not so much the rest of the borough. There is low coverage generally across the borough, but actually we are such an outlier in North Hackney, and we've always had such a low uptake in vaccination, including in some areas of one of the surgeries in the north of Hackney have maybe only 40% of their children vaccinated at the age of 1 year. Which means that then we're more likely to have vaccine preventable diseases as outbreaks. So the measles outbreak, for example, in 2018 was because the vaccination uptake was so low. And one of the key things around vaccinations is you need to have a certain level of coverage to keep the diseases at bay. So with measles, for example, it's 95%. So you can see how an area like Hackney is particularly vulnerable, and some of that risk is transferred over to Haringey as well, and other surrounding areas where actually vaccination uptake has decreased year on year, and particularly during the pandemic. Next slide, please. So yeah, this is just a bit about what vaccinations are and how they work. So vaccinations contain either a very weakened or a dead form of the virus or a bacteria that they're protecting against, or they contain a part of a coat of a virus, so just a small fragment of it. And what happens is that is produced in the lab, and vaccinations are produced from that weakened or part of the coat of the virus. And then when a child is vaccinated or an adult is vaccinated, it prompts the immune system, so the defense system of the body, to fight that virus or the bacteria and produce lots of what we call antibodies, that are kind of like substances that keep the memory of that virus for longer term, so that if you then encounter that virus or the bacteria in the future, your body will fight it, and often you might not even feel unwell. So that's the principle of vaccination. It's really to prime your body, prime your immune system, so that actually if you encounter it in future in its real form, you can counteract it and you don't become unwell. And it helps prevent the spread of infection in communities as well. And it is the most effective way of preventing infectious diseases for both you, your loved ones, and your community. Next slide, please. So this is just a diagram of how vaccines work. So you can see the child being injected there, and the antibodies. So these are the substances that your body produces, which is the blue with the little shield in the middle. And these are there then in your immune system, and often you have these long-term, perhaps lifelong. Sometimes you might need a booster of a vaccine because some of the immunity might go down, or actually the virus, for example, might change. So we know with flu, year on year, there's different types of flu strains, because actually they're very clever viruses, and they can evade the immune system by changing very slightly so that we don't recognize them. So the reason why we have a booster is either to remind ourselves, so because the memory sort of reduces over time, or to try and account for the fact that viruses do change and that we need to keep on top of the most serious strains. So we have a boost every year or every few years, for example, to help protect us against some of these illnesses. Next slide, please. So I thought I'd include this diagram because I think it's just so dramatic, the impact of vaccination, and it shows that really clearly. So this shows the number of cases of serious infectious diseases in childhood. So diphtheria, which can cause throat infection and can cause airway problems in children, used to kill lots of children 100 years ago, or even less time than that. And then suddenly, we had the introduction of the vaccine in the late 40s, and the cases of diphtheria just went down dramatically, and now we hardly ever see it. And the same is repeated for pertussis, which is another type of infection, and that causes severe cough and respiratory distress in young babies. And we offer this vaccination in pregnancy to help protect newborn babies. So that's why when you're offered your pertussis vaccine as a pregnant woman, that it's really important that you have that vaccine to protect your young baby who has less developed lungs and is more vulnerable to some of these infections. And again, repeated in measles. But the problem here is that we can't get complacent. Actually, we need to sustain vaccination and make sure that future generations continue having vaccinations, and we as adults and as community champions, we actually make the case for vaccinations, because it doesn't take much for infections to be reintroduced to the community, such as a measles case back in 2018, where we had 500 children in Hackney and Haringey, mainly in the Orthodox Jewish community, who were unfortunately affected by measles. Next slide, please. So there's a bit of kind of a few myths, a few misinformation that does tend to spread around vaccination. And the first one is around vaccinations, particularly the measles, mumps and rubella vaccine causing autism. And this was because of a very poor study done by a doctor in the late 90s called Andrew Wakefield. And since then, actually, there's been lots of trials to find that there is no link between the MMR vaccine and autism, and they've done tens of studies with thousands of children, and there is no long-term impact on either your neurological system or it causing autism in the future, or actually any other vaccine for that matter, not necessarily the MMR. We know that a lot of mothers in particular are worried that there's too many vaccines in one go. And really the answer to that is that on a daily basis, we are encountering millions of bacteria, yeast, viruses, or, even in the water that we drink or the food that we eat, it's full of bacteria. And the immune system can deal with that really easily and produce antibodies. So actually having an injection that has 8 fragments of diseases to help protect against them will not overload the immune system. And also there's another kind of bit of a hesitation that I come across, particularly in the Orthodox Jewish community, about waiting until the child is older, and actually the child being too young to have the vaccination. But actually some of these vaccinations, well, all of these vaccinations are timed such that they are given when the child is most at risk of some of these viruses and bacteria, and some of it where their immunity that is passed on in the womb from their mother starts to fade. So actually, if you leave it later than is recommended, you're putting your child at risk of these vaccine preventable infections. Vaccines don't cause allergies and also don't contain mercury. I know allergies comes up often, but that's not an issue really. It's very, very rare that you suffer with true allergy from vaccinations, and most of the time people confuse side effects with allergies. Next slide, please. So this is the vaccination schedule. So it starts at 8 weeks of age. But actually, we're probably looking at this, it should start at pregnancy, because like I said, the first way to protect babies is to have the pertussis vaccine that protects against whooping cough. And it particularly is a problem for newborn and young babies. And this is something that you're offered in pregnancy, as well as the flu vaccine. And that's there to protect children, babies, very young babies. And that's something that you can proactively do as a pregnant woman to protect your newborn baby. And then these vaccination schedules continue until you can see down right at the bottom until the 14 years of age. So we are having a focus at the moment of this year 9 booster, and particularly protecting the community against the meningitis ACWY vaccine. And we'll give you the clinic dates of where we're going to help catch up some of these children who might have missed it, either due to the pandemic or a lack of awareness around the importance of of vaccination in protecting against some of these very serious illnesses. Next slide, please. So just a bit more about measles, because I think certainly talking to a few parents, there's a misconception that measles is just like a cold and it's not something that requires any intervention or any prevention for. But I mean, measles is a very infectious disease, and it can cause serious problems in up to 1 in 5 people that have it. So it can cause things like deafness, it can cause disability. We had a case of a child in the 2018 outbreak who ended up with deafness and ended up on intensive care. And it has led to deaths in the past because of this infection. So it's not having a cold, it's not having a flu, it's a really serious illness. And you know, it's really important to protect against it. And having the MMR, the measles, mumps and rubella vaccine, is the best way to prevent it. And having the 3 combination 3-in-1 vaccine is the advised way to protect against all these 3 infections, rather than having single vaccinations. There's no evidence that that's any better than having the combined vaccine, and you do need 2 doses of the MMR vaccine to protect against all 3 infections. Next slide, please. The other key vaccination in childhood is flu, and this is caused by the influenza virus. And again, this is something that, more than being unpleasant, can, in some children, particularly those with underlying health conditions, cause serious infections such as bronchitis, bronchiolitis, and pneumonia. And it spreads very easily. The other thing with children is that they are really reservoirs of flu vaccines, and they help spread vaccine around the community. So by vaccinating children, you're helping to protect older, more vulnerable, you know, grandparents or aunts and uncles. So there is a value in vaccinating your children. And I know that in the past there's been issues around the nasal spray, which might contain gelatin, for example. But actually, if you're worried about things like that, then please talk to us, because we can give alternative flu vaccines, such as the injection instead of the flu nasal spray, if that's something that's requested. Next slide, please. So yeah, this is just to reiterate that message that it's never too late. So even if your child is really late in having any of their vaccines, or maybe you're an adult and you've not had some of the vaccines, we're very keen to catch up and give you the vaccinations at the whenever you decide is right for you. But it's better to be protected than to leave it and not consider it priority. Next slide, please. And just very quickly, these are some of the clinics that we're putting on to help try and focus on childhood immunizations. And our lead nurse, Catherine, who's one of the panelists, is leading these clinics. So we've got some at Lubavitch Community Clinic and Spring Hill Surgery, as well as Stamford Hill, happening mainly on Sundays. The Lubavitch clinics are on Thursdays, and Vaccinations UK, who's our school-age provider, will also be at Stamford Hill practice to help catch up those children in year 9, so age 13, 14 years old, who need the meningitis ACWY vaccine, which is the type of meningitis, the 4 different strains that it protects against, as well as with polio vaccines as well. So really important that if your child has missed out on that, because there isn't always a provision in some of the Orthodox Jewish community schools, to bring your child along to that and help protect them against this very serious illness. Next slide, please. So this is all that I wanted to talk about. We didn't really want to make it too much of a lecture, and the key thing is to try and address some of the questions. So yeah, very happy to now go over to the question section and start going through some of your queries.
Thank you so much, Dr. Khan and Dr. Dallas. And I can see that Catherine has joined us as well. You were having a couple of technical issues just at the start. Do you want to just introduce yourself, Catherine, quickly? And then we'll move on to some questions.
I'm Catherine Sekwala. I'm the immunisation lead nurse and also the infection prevention control nurse for City and Hackney. Thank you for having me.
Welcome, Catherine. And just before we move on to questions, one final thing from me. You'll note that obviously this is a discussion about winter illnesses, including Strep A. Yes, sorry, Karim, we've already talked about Strep A, but happy to cover that off a little bit at the end if you have any specific questions. One thing you'll note that we didn't talk about on the slides was COVID. Obviously, we've heard a lot about COVID over the last few years, and maybe a little bit too much, but it is still circulating in the communities and at quite high levels. It's, you know, it spreads more easily in winter time when people are gathered inside more with their friends and their loved ones. And it's just to say that the COVID booster campaign, so there was a booster made available in spring and another booster made available in autumn, is coming to an end on the 12th of February, so that's in 10 days. So if there is anyone who would like to get their COVID boosters who haven't already had them, it's just a plug from me really to come forward to get those before that campaign finishes. Okay, so we've had one question, but if people have other questions, please do put them in the chat and our panelists will work through them. But I'll go to the question from Natalie to start us off then. So thank you, Natalie. You were asking for some clarification on why there's a need for an additional polio vaccine, so the booster vaccine at this stage. And if children have already had their 5 doses, do they need to get their booster? So I'll put that out to the panel. Does anyone want to take it, or shall I allocate?
I'll take that.
Thank you, Dr. Dallas.
Thank you for the question, Natalie. So I think the need for the polio vaccine now is because the polio vaccination schedule is very effective. The reason we've got this advice to give people boosters, and that's only in London, is because we found this vaccine-derived polio in the sewage of some areas of North London. Okay, so this isn't a UK thing, this is just a sort of a London thing. And so even if you do have your 5 vaccinations, we're still recommending a booster because it will make you even less likely to get it. So if you've missed any sort of parts of the schedule or you're not up to date, then we'd definitely recommend it. And the advice is that even if you have had your 5, it will provide additional benefit to protect you against this strain which has been found in the sewage water.
Thank you so much, Dr. Dallas. I'm just, can you still hear us? I'm just checking that your sound is still available.
Yes, we can hear you.
You can hear us. Okay, great. I'm just seeing if Dr. Dallas was still able to speak as well, or if his sound had gone. I'll just see if Dr. Khan or Catherine, do you want to add anything to that, or should we move on to the next question? I just wasn't sure if Dr. Dallas was finished and whether his connection has gone.
Yeah, just to say that, and I think there's another question by Ben around the polio booster being offered to children aged 1 to 9. So the phase 1 of the program, which was around providing an additional booster to those children that are already been up to date with their vaccination. So that offer has now ended. So you don't need to bring your child who's already up to date to have an additional booster, because actually what the public health authorities were doing was assessing whether there were more cases of poliovirus being found in sewage water. And thankfully, actually, the cases after autumn started to go down, so they weren't detecting as much. Initially, it was just to try and reduce the risk of paralysis, so polio-related paralysis in the community. So they were offering the booster to everyone. And then when they stopped seeing those signs of polio in the sewage water, what they decided was to end the first phase of the polio booster, which is to give it to everyone in December. And now really the focus is to help bring those children that are either under vaccinated. So if there's any vaccinations that they're missing, say if they've not had a polio vaccine at the age of 8 weeks or 12 weeks, to absolutely prioritize them. And secondly, to prioritize those children who are completely unvaccinated, of which unfortunately, particularly in North Hackney, there's quite a few. So that is the focus at the moment, is to focus on those children that are partially vaccinated or completely unvaccinated.
Thank you so much. I'll move us on to a question from Karim, just around the symptoms of Group A Strep, who missed the start of the. Very sorry to hear about your loss, by the way, Karim, and very happy to go back over that again. So again, does anyone want to volunteer to answer the question just around the symptoms and how to recognise Group A Strep and associated infections? Go on, Dr. Khan, you've come off mute.
Sure, I was just waiting to see if anyone else was going to volunteer. I mean, yeah, I also want to extend my condolences. I think that's a really awful thing that you've gone through, Karim. And, you know, there have been cases of fatalities both in children and in adults with this Group A Strep, of which we do see, unfortunately, every now and then. But there was a real peak, as Carolyn was mentioning early on, just before Christmas. Now, Strep A is it's difficult because in the autumn and winter we have lots of colds and flu viruses anyway circulating in the community. So some of the symptoms can be overlapping around sore throats, having a fever. What we tend to say is if you've got a sore throat, fever and a cough, that's more likely to be a virus than a bacteria, because actually bacterial infections don't tend to give you coughs, whereas viruses such as colds do give you a cough. If you have a worsening sore throat, if your child has a worsening sore throat, they've got tender sort of neck lumps appearing, which is the lymph nodes where you produce white cells that fight infection. They're not eating and drinking, they develop a rash, and you're worried about them, then the advice, like always with sick children, is to contact your GP for even a brief consultation about how to manage this and what to look out for, because it does vary according to the age range, what kind of symptoms that we look for in terms of young children versus older children and adults. But the key thing is not eating and drinking, struggling breathing, a rash that appears. If you're generally, if you're you've tried paracetamol and ibuprofen in your child, or indeed if you're suffering from an infection and actually that doesn't do much either for the temperature or making you feel better, and they're still not eating and drinking, these are all what we call red flags. These are all things that would worry us. And in City and Hackney, we've got in general practice, we've got the duty doctor scheme. So I know there's a lot of stuff in the media around not being able to get enough GP appointments, and that is a problem. We don't have enough GPs to be able to provide GP appointments to everyone on the day, but there's always a duty doctor system. So if there's an urgent problem, there's always cover between 8 and 6:30 in every GP surgery across City and Hackney. So if you are worried, call up and ask to speak to a duty doctor, to the emergency doctor, even for just some advice, and they'll be able to advise you. And then obviously if it's out of hours, calling 111 would be a good way of trying to get that advice, and then they can direct you to the best service, whether that's out of hours or to A&E.
Thank you so much, Dr. Khan. Really helpful overview there. So I'm just aware that we don't have any other questions in the chat at the moment. So please do take this opportunity to ask the panel any questions that you may have. I can see that Sarah has got her hand up, and so she's very welcome to come in. Don't need to have your hand up, Sarah. Come in.
Thank you very much. I wanted to ask about these scarlet feet, the Group A Strep. One of the symptoms that you mentioned is cellulitis. Does that mean if somebody presents with cellulitis, you have to worry about everything else? You know, around, I know that we had a cellulitis in the family, and there may not have been a connection to Group A Strep, but there was no consideration about the precautions that have been mentioned on this call. And it was quite recent, actually.
So I'm not sure, Sarah, was that something that was mentioned in the first part, the strep?
Yes, that a Group A Strep can cause impetigo, cellulitis, pneumonia. So seeing that this is in the air, and that, you know, I'm aware that there was a case of quite bad cellulitis, and well, maybe there was no link, but I'm asking the question.
Yeah, I mean, strep A is a very common bacteria, so it lives on our skin normally. It's just at some points you can have a strain of the strep A that's particularly infective and can cause infection. And if there's underlying health conditions, that can also cause a problem. But also, actually, cellulitis can be caused by lots of different bacteria. So it's not necessarily that all cellulitis is caused by strep A. And even if it is caused by strep A, the likelihood is it won't give you what we worry about, which is the invasive strep A disease that causes these kind of multi-organ kind of problems, and then ends up causing sort of serious sepsis in people and leading to hospital admission and unfortunately death. So yeah, so there's lots of different causes for cellulitis. A small part of them will be strep A, and out of those, a very small minority will be invasive strep A disease, which will cause these kind of serious complications. But yeah, I don't know whether that's helpful.
Yes, it is. And if you don't mind, if I stop me, Carolyn, if I'm carrying on for too long. But in terms of the graphs and the data that you've shown, and we're all too aware of the lower uptake in this part of the borough. But I just wondered if the graphs improve, if you look at uptake once they reach a slightly older age, because when you see the data, the difference is much more stark at 12 months than it might be at 5 years. I appreciate everything that Dr. Khan has said about immunizing on time, and we're pushing for this all the time for all the right reasons. But I was just wondering if it is reflected in the overall data.
Thanks, Sarah. I mean, I'm happy to start with that one and then pass on potentially. So you are correct. Typically, we see an inequality across geography in City and Hackney. So as Dr. Khan said, in the northeast, compared to the other areas, there is lower uptake of vaccines across the board. And so there's a gap. That gap does get smaller over time. So as children get older, more people in North Hackney are coming forward for vaccinations. However, the gap never closes. So there's always lower uptake in the north of Hackney than the other areas across all ages. But as you said rightly, the difference isn't as stark for older children. However, as for all the reasons Dr. Khan has said, and then I might go back to him just to reiterate some of these key ones, we wouldn't encourage delaying vaccination. It's really, really important to get them on time, because obviously for the time the periods of time that children are not vaccinated, they are at risk of becoming unwell. And so it is good to see that gap closes over time, obviously, but we would like to remove it altogether. I think that's what we're saying. I don't know if Catherine or Edward want to come in on any of those points.
Yeah, I was interested to hear from Catherine, because Catherine's got a huge amount of experience with the community and kind of, I guess, some of the on the ground, what do you hear about why why parents might not want to vaccinate and why they do delay? Is that something that you come across very frequently?
Yes, I think a lot of it is that, you know, the immune system, they want the child to be much older to start the first course of immunizations, you know. So say, for example, the first immunization can take place when the child is perhaps 12 or 16 weeks old, as opposed to 8 weeks old. So that is most of the main problem why parents to choose to immunize late. But our advice is, you know, try not to immunize your child late. And there's other reasons as well, apart from just protecting your child against infectious diseases. The older the child gets, it has a more psychological impact on them. So this is another message that, you know, often or every time I'm vaccinating to make across to parents, because it's rather unfortunate for a child of, say, 4 years old to be having their 8 weeks vaccination, and that can be quite traumatizing for the child. And as professionals, you know, the danger is they associate the professional with pain, and that is something that we want to stop happening. So that is the main advice, you know, immunizing your child promptly. It's a good way for 2 reasons. It's protecting your child against diseases, and also preventing them from having ongoing psychological issues as well towards vaccinations or needles or medical interventions as well.
Thank you so much, Catherine. That's a really, really helpful overview, and I didn't realise some of those concerns in the community myself. And with regards to the concern about, because we do hear it a lot about children being too young to have the course of vaccination that is currently recommended in the schedule. I don't know whether you want to come back on, you know, why that's not the case, or if maybe Dr. Dallas wants to come in, I don't mind, but just to reassure those on the call that actually that is completely not the case, and it's so much better to do it on time.
Yes, well, I'll chip in now if that's okay. And thank you for that lovely answer, Catherine. So the vaccines are designed to sort of fit in with your body's natural immunity and to provide a good immune response. And it's all data driven. And if there was a risk of overloading the immune system or something like that, then it obviously wouldn't have been put into force so early. So the data shows that they are very safe, and you don't get an over-exaggerated immune response, or it doesn't overwhelm the child from those early years. And I think Catherine's point of the child having kind of fearfulness of medical professionals is actually a very true one, because I see patients in the hospital, and you know they do start to get a little bit more scared as they get older. So I think that's a point you just made.
Thank you so much for reiterating that. Sarah, is it on the same point? I was going to answer the question about COVID vaccines in the chat, but I can come to you if it's on that same point.
It's actually not on the same, but I want to make a number of observations, and I'm happy to wait.
Okay, brilliant. It was I just wanted to clarify the question from Farah in the chat around the COVID vaccination offer. So I mentioned earlier that the booster campaign is coming to an end in 10 days. And it's a good question, because even I get a bit confused, because I know there has been a number of different doses of the vaccine. So what we're calling the evergreen offer, which is the first and second dose of the COVID vaccine, will remain open to anybody that is eligible. So that isn't coming to an end. But there were 2 boosters, one that was offered in the spring of 2022, I think, gosh, and one that was offered in autumn of 2022. Both of those offers will be coming to an end on the 12th of February. So yes, you'll still be able to get doses 1 and 2, but not doses 3 and 4. So just to clarify that one. And Dr. Khan has helpfully put a link in the chat for more information about that. So thank you. Okay, Sarah, over to you.
Thank you so much. I first want to make a public acknowledgement of London Borough Hackney, of the kind of approach they have taken towards making sure that information of this importance reaches the community in language and in areas and the right places where they will be seen and they will be noted. There's been a proper recognition that the communication channels in the community are different to mainstream channels. And whereas, you know, the wider community will get information from social media, from newspapers, from other places, the Haredi community, I won't say nobody will access that information in that format, but there will be little access in that format. And just by way of example, I know that on the 24th of January, you had a similar webinar on winter wellness. And other than knowing about it through these meetings, I would not have known that this was taking place. So I think that was just a case in point. So we are hugely grateful that in this important area, you are really going out of your way to make sure that this information reaches the community, and then there is an offer where community members can actually go out, and it's being offered in a number of different places and being promoted by various different agencies and all over the place, and in the hope that people will recognize the importance. Many have, and these booster campaigns, if not taking up extra boosters, I am aware that families have gone to check on the red books and made sure at least that the regular schedule is up to date. And I can't say reiterate how grateful we are and how important this is, and that we should not about to relax this anytime soon. And everybody has a very important part to play. And I know, Samina, you're very quiet, but Samina is our champion in this part of the borough for the Haredi community, and we're very grateful for that. We get to pick up her little people in the adverts on a weekly basis. Maybe they'll become to fortnightly basis. So thank you very much for that. That really is very, very important. Just on the measles, I wanted to mention, and you know, there were, unfortunately, when we had that outbreak, cases, and sometimes the cases may have ended up in hospital, not with the, you know, indirectly through measles, because if a child has been very unwell with high temperature and it was measles, and they end up in hospital just because it got dehydrated through it. So they may not end up in, you know, in intensive care, but these may still have ended up in hospital through exaggerated symptoms of being unwell. So I just wanted to mention that. And the other point that Dr. Khan mentioned, that the flu nasal vaccines may have a porcine element. We have in our possession an updated letter from Rabbi Adler of the Medicines Information and Kashrus Service, which he says that it is perfectly okay from a kashrus perspective. It's kosher, it can be used as a nasal spray. Nevertheless, of course, some people may still want the injection instead, and as Dr. Khan rightly says, they can ask for it and get it. So thank you very much.
Thank you, Sarah, and I know you worked tirelessly to help us getting the information out, and so we are really grateful for that. And you know, just to say that we are, you know, we're learning as we go with all of this, and so we are doing our best to get the information out in the right format and in the right places, and at the right times as well. And we are very open to working with you to improve the way that we do it. And so yes, it's a work in progress. But thank you very much, Sarah. Okay, so we've got 5 minutes left. We don't have any other questions in the chat to cover, but I don't know if anybody wants to come in on anything final that they think that they should have said but haven't, or otherwise we can let people get back to their afternoons. I'll just open it up to Sarah, Samina, and Dr. Khan, Dr. Dallas, or Catherine.
Just a very quick one. About vaccinating early. So if you have a premature baby, we would still vaccinate sort of chronologically. So they can still be very, very small, and we would still vaccinate at the allotted times from the UK schedule. So that would be, you know, at sort of 2 months, for instance, even if they are very, very small. So just another sort of bit of evidence to show that you can definitely have your vaccinations early, and it's considered very beneficial and not harmful.
Thank you so much, Dr. Dallas.
Yeah, hi, I'm the under 5s immunisations coordinator for the northeast of the borough. I just wanted to mention and pick up where Dr. Khan had mentioned around the polio booster DPT and the meningitis ACWY in year 9s, age 13 to 14-year-olds. There's a huge gap in the community around lack of awareness, where these boosters are offered in all the mainstream schools via the provider Vaccination UK, but the independent Haredi schools, they're not accessed by the provider. The schools prefer not to have like school-based vaccines in most of the schools. So therefore, that's why we've taken it out to the community setting in the clinics. But the issue is that, you know, I've had like parents asking me, but why is it our community? Why are we, you know, told to take another booster at that age? And I've had to explain that, no, it's like offered, you know, in all the schools at that age group. And I think that the message is really around this particular boosters. They protect into adulthood. So it kind of completes the course. So yes, it's really important to kind of bear that in mind and that it is accessible. Thank you.
No, thank you so much, Samina. Really helpful. Catherine, just to say that Catherine, I mean, I checked with her before we shared the slides, and she did confirm that she was happy for her details to be shared. She's done so much work in the community around vaccinations, and so you do have her details in the slides. We'll share the slides after this. So, I mean, there's plenty of avenues there to ask questions, so via your pharmacy, your GP, or you can contact Catherine, who's an immunisation nurse and has worked in the community for a number of years. So any final comments from Catherine or from Dr. Khan?
Yeah, thank you. Just to say that, you know, if you're not sure about what immunisation your child needs, you can always contact me. You can come and see me at Lubavitch and sometimes at the Sunday clinics. Happy to go through the red books with you. And also, if you're not able to get appointments regarding, you know, the year 9, the school leavers boosters, again, you can talk to me and I'm sure I can arrange for that to happen if it's not happening in the schools as well. And many of you know also that I've done a number of home visits. So again, if you know, particularly, you know, the community I know are very, very busy, large families. If you need a home visit, I'm happy to come and vaccinate the entire family, including aunties and uncles and cousins' children, which I have done. And, you know, it's great fun. It's great fun. I enjoy doing what I'm doing. That's why I'm still here and I can't get out. But, you know, please feel welcome to come talk to me anytime and call me. Thank you.
Thanks, Catherine. That's an incredibly generous offer. So yeah, thank you for all of your hard work. Okay, 1 minute left. Any final comments from Dr. Khan before we wrap up?
No, I can't follow after that very generous offer from Catherine. I think
no one can.
Yeah, I think the key thing is, you know, just please ask questions. If you're worried, you know, we're really lucky to have Catherine and you know, others around that can answer your queries, your questions. We obviously would like you to be vaccinated, but actually what we're really interested in is actually giving you the right kind of information for you to be able to make the right decision for you and your child and the rest of your community. So that's the reason why we're here, and that offer will always be there. So thank you.
Thank you so much. Okay, so we're at 3 o'clock. I was just going to wrap us up, but Sarah, I know you wanted to come in. I saw you come off mute.
I was just
Very
wondering whether it's worth sharing that we're working on a document called Frequently Asked Questions, specifically around immunizations, for which we're taking clinicians to answer that. Once it has gone through all the processes and it's ready, we hope to have that endorsed as well. We will work out exactly how we will disseminate that. Part of that plan will be like leaving them in places like children's centres and in surgeries, and we will try and promote it in other ways as well, preempting some of the concerns that have been raised today, and you know, many of these issues that we know hesitant parents struggle with.
Brilliant, that sounds excellent. Thank you, Sarah. Okay, I'm going to finish us there. Thank you ever so much to all of our panel members, and Sarah and Samina for your help as well, and everyone who worked in the background to set this up, and for everyone who came to join us this afternoon. I hope you have a lovely rest of your week, and thanks again. Goodbye, everyone.
Thank you.